So Marla, tell me how old you are.
I'm 40 years old.
And do you live here in the city?
I live in Brooklyn Heights, Brooklyn.
Awesome. So what brought you to our practice this morning?
Well, I've used Dr. Rapaport previously in a couple other procedures, which I was happy with, and today I have an opportunity to deal with some of my trouble issues underneath my eyes with AccuTite.
Awesome. And how did you hear about AccuTite in the first place?
Through your office, and then I've done some personal research as well, and everything seems, for me, a better option because I didn't want to do surgery. I wasn't ready for that yet. So this is a really good opportunity, and I'm excited about it. All the before and after pictures I've seen of other people are really encouraging, so I'm hoping to get the same benefit of it.
Awesome. Thank you.
Really, your main problem is the puffiness of the fat and the skin that's allowing that to bulge out. And what this is going to do is treat pretty much right over that fat, with the idea being that the heat will tighten that fat sort of from the top and lay things down a little tighter and better. Now, the effectiveness of the procedure is entirely based on your body building collagen, and that takes time. So the truth is, I hope you don't mind it, but the full result of this, we're not going to know what the full result is for about 6 months. You are going to be significantly swollen. I can't predict exactly how much, but you should expect to be swollen and quite possibly bruised for a good few days. Okay, you accept that, you understand that. Okay, and you understand, we can't tell you exactly what it's going to do because nobody really knows yet. The same device, and you saw in our emails, also used for labiaplasty. It tightens things. So there you are. Do you have any questions?
Just if there's any risk as far as like damage to my actual eye.
We have God forbid, we have no reason to think that there's any risk of that. I would say I've never seen it happen, but I think in theory, based on what we're doing, there is a very small but imaginable risk that there'd be some kind of bleeding or something, and I would have to actually open something up to stop a blood vessel, but I've never heard of that happening. But I'm just saying it's not outside the realm of physical possibility that happens. We'd both have to be really unlucky that you'd have to end up with an incision for me to stop a bleeder. But that would probably be the worst thing I can imagine. And I don't think that's going to happen to you today. I just theoretically it could happen. Okay? What's going to happen is we're going to get you into the OR, and I'm going to prep you, and then numb you up with an injection, just as I was doing surgery on your eyelids. And so this whole lower lid area is going to be injected and numbed up, and again, that can cause a bruise. We're going to give it a few minutes to work, and then we're going to do that AccuTite treatment. The treatment itself won't take more than 10 minutes. Okay? And then you'll be done. All right, so we're going to mark Marla for her AccuTite treatment to the lower lids. What we see is pretty obvious. She has more lower eyelid fat on the left side than on the right, and we'll just mark it generally. Lower your chin and look up. There you go. And now look all the way hard to your right. We don't really see much here, but we know there's fat there. There isn't much of a clear bulge. Here's her tear trough. And we're going to be going right up to there, and we'll be entering right around there. Let's do the same thing here. It's a slightly smaller collection of fat. Is this consistent, what we see here, that your left is more? And look all the way there. And there really isn't a true bulge. We know there's fat there, but there isn't a true bulge laterally where so many people have that. Okay, and we'll go in around there. Great. If you can just take... I'm sorry. like this. Any reason to believe that I'm subseptal. Take a shot, a picture, a photograph, done. Okay. And I don't think you're going to feel any pain now, but you're going to hear the machine firing, okay?
And so fast. So I had this conversation with a bunch of our colleagues, and some of them said, you know what, if it heats up and you feel like you're limited, then put a cool up, go out to the other side and come back. The thinking is that kilojoules is work, right? You're doing work to the tissues. So you want to be able to impart that energy to get the desired effects. Even if your temperature is enough, you may
Come down. Oh, no question, I'm submuscular. I don't think I'm intraceptal.
you just put your thumb there.